I'd like to introduce Joe from England, who takes LDN for Bechet and MS. Thank you for joining me, Joe.
Hi.
Could you tell me when you first started to notice symptoms?
Oh my goodness, I had symptoms all through my teenage years actually for the Bechet disease, through my 20s, especially after the birth of my children, and it was ulcers in my mouth and my throat, and then probably during my 30s I was hit with severe fatigue and vaginal ulcers and anal ulcers, which are one of the common symptoms of Bechet's disease. Kept it to myself because I was quite embarrassed.
Could imagine.
When I was being looked into, people were trying to rule out ME, rheumatoid arthritis. They weren't quite sure what was going on. The fatigue was just so great I couldn't do anything. Probably in 2009 I finally got a diagnosis with Bechet's disease, and then I was bombarded with every immunosuppressant you could possibly imagine. Drugs just ruled my life because the ulcers were so severe, the fatigue was so severe, had polyarthritis as another symptom. The symptoms actually just started building up. It was one thing after another. Skin lesions, hair loss, problems with my eyes, my memory. And then all these drugs just impacted me greatly. I didn't get any better. They started giving me infusions of infliximab once a month for a day in the hospital. Over the course of a year, they didn't do any good. So they gave me Humira injections, and I must have took at least 6 months to 8 months course of those at home, and I just became incredibly ill. My Bechet's got worse. Well, it dampened my immune system, but I was hit with flu bugs, types of thrush. Fatigue was just so intense. And then I got, in late 2010, early 2011, I was hit with a headache that just would not go away. It was just incredible. I couldn't even get out of bed some days with this headache. So they rushed me into Addenbrooke's and did an MRI, and within a week they told me I had MS, which was a real shock. Within 2 years of being diagnosed with the Bechet's, I then had a diagnosis of MS, and they didn't know whether some of the symptoms I'd had since my children were born in my early 20s were mild symptoms of MS, or whether the treatment, such as Humira, for the Bechet's disease had actually been a very rare side effect, which had caused the MS. And that we'll never know. But at the end of the day, I've now got MS as well. And within a week of being diagnosed with the MS, my headache improved, but my left side became weak, to the point where I couldn't lift anything with my left arm. My left leg was being dragged. My speech was gobbledygooky. The wrong words were coming out. I knew what I was saying, but it just didn't come out of my mouth right. And the doctor said, look, you're going to have more treatment. And I said, no, I've had enough. I've put the doctors on pedestals, and I've took every drug you've said to take, been a good girl, so to speak, and the drugs I've taken haven't done any good. They may have caused the MS, and I just feel completely toxic. I feel like if you ignite me, I'm going to blow up, and I can't do it anymore. So I stopped everything, apart from gabapentin for the neuropathic pain, because that was so intense down my left side. I had a carer at the time, and she came in every day to help me. And this time last year, she came in with a newspaper clipping, a little article from the Daily Mail about LDN. And I've received loads of little articles over the years about Bechet's disease or problems, etc. And I've just stuck them in my drawer. So this little article went in my drawer as well. I never thought anything more of it. And a few weeks passed, I cleared out my drawer and I got this article out on LDN, and I sat there and I actually read it. And I don't know, a light bulb went on, and I thought, I'm going to ring this LDN trust, see what they have to say, get this information pack, read it. And I did. And I just was drawn to it. It was an urge. I rang you guys. I was guided, really, so to speak. I didn't go to my GP. I didn't go back to my consultants. I thought, I'm doing this on my own if I'm going to do it, because I'm not going to be talked out of it. I'm not going to be talked into these drugs that they want. I'm going to do this on my own. And if this drug is as safe as what it's supposed to be, it's not going to do any harm. So I went online, and with shaky hands, more in fear and trepidation, I got an online doctor, and my husband said, you're nuts, I can't believe you're wasting money, I can't believe you're doing this. My family said, we will support you, but you should go to the GP. And I had a lovely chat with this doctor online, and he prescribed LDN, and then the prescription went up to Glasgow, and I spoke to them in quite a lot of detail about the drug, and then it was posted down to me, and I took it. We all sat around until 9 o'clock that night. The first night I was supposed to take my 0.5 milligram, and at 9 o'clock we all went in the kitchen, and everyone watched Mum take this little drug, thinking, gosh, this is going to be a miracle cure. And because MS had got me dead and buried, my diagnosis, we were all in mourning for Mum and wife and me. My life was over as far as everyone was concerned, and as far as I was concerned, it was a devastating blow to us. So to everyone coming into the kitchen and watching me take this drug, it was wonderful, and I took it. And that day, leading up to taking the drug, was an awful day. I was very ill. My left side was really bad. My memory was bad. My speech was bad. Muscle spasms were, they just ruled my life. This MS hug thing, they called it. Life was pretty grim. For what they call a mild form of MS, life was still pretty grim. I took this drug, and for the first time in probably 4 years, I slept the whole night. Couldn't believe it when I woke up. I couldn't believe I'd woken up to the morning, rather than waking up 2 hours after I'd gone to sleep and then being up all night. I'd gone through and woke up in the morning. I hadn't done it in years. And rather than my husband getting up and coming around and helping me out of bed, I threw my legs over the side of the bed, and I stood up, and I was like, oh, Joe's back. And I took the smallest amount of his medication. I couldn't believe it. And we just thought, gosh, this could just be coincidence, or something's working. And I took it for the month before I had to increase it to the next day. And that was the most wonderful month of my life. I slept better. My movement was better. Well, it wasn't 100% better, but I would say 50% better. I mean, to have so much mobility back, and clear thought, because you've had a good night's sleep, you get up, you think that much clearer. But I actually thought that much clearer. That MS fog was better, if you know what I mean. And then as I increased over 4 or 5 months and got up to my 2.5 mil, it was just amazing. I had more control over my bladder. I was doing things I hadn't done in years. It was just amazing. A wonderful medication for me. And I haven't looked back. I've tried to go above 3 mils, but really 3 mils is my limit, where I'm happy, my body's happy. I've been back to my consultant at Addenbrooke's. They've done another MRI, because infection seems to be one of the main concerns with me at the moment. I was on antibiotics once a month for 10 days, every month. And since LDN, I have an infection now, maybe 1 in 5 months. Oh, wow. So that's improved. But they've done an MRI, and I've had no further lesions since 2011. And the year I've been on the LDN, the doctors actually thought if it had been, my MS had been caused by the Humira, the MS would have progressed quite quickly, and it hasn't. They're very pleased I'm on the LDN, although they won't prescribe it. But I'm not going to beg. I'm quite happy to have my little online doctor and do it this way. And yeah, it has changed my life. It's changed my outlook, my family's outlook. We have hope, and hope for a good future where we didn't have it before. And although it's helped me health-wise, and I know it doesn't do it for everybody to this degree, but even if it had changed one thing out of all of my symptoms, I would still have took it, because just to have one thing alleviated. But I've actually benefited with the majority of the things I had. My Bechet's is more under control. I have less lesions, less ulcers. I'm manageable. It's more contained. And I haven't looked back. And I thank the LDN Trust and everybody who raises awareness. Because
could you tell us, Jo, what Bechet's disease actually is?
Bechet's disease, it's a rare but chronic multi-system disorder. It causes inflammation in your blood vessels anywhere in the body. So essentially your whole body's could have a breakout of Bechet's disease. I think the only thing that isn't affected is your hair. And with me, it started many years ago with ulcers, and that's one of the main symptoms, and it's sometimes some of the first symptoms that people get, and it's quite common for it to start in your 20s, which it did with me. And looking back, although it took nearly 20 years to get a diagnosis, they were 20 terrible years for me, because in the early stages I was getting the ulcers, but you don't just get throat and mouth ulcers, stomach ulcers. You also get ulcers in your bowels, around your anus, and around your vagina, and inside the vault, which I did. And it was greatly embarrassing. I didn't have anybody I could go to talk about it with. And I never went to my GP because I was so embarrassed. And it caused a lot of concern because I had these lumps and bumps and blisters and ulcers. And I was in a very loving, or still am, in a very loving marriage. And I felt very guilty for having these thoughts, what's happened? I've been faithful. Has my husband not been faithful? Have I caught something? Because obviously this isn't right. And I did suffer in silence for quite some time before I spoke to a GP about it. And to be honest, I didn't get much support. They told me I could go up to the gum clinic, but I didn't. Because they would come and go in stages, and you'd have them for long periods, but equally you would not have them for long periods. So they were going on their own accord eventually. And just before my diagnosis, I had a consultant actually ask me outright, do you have any of these symptoms? And I just burst into tears and said yes. And finally, after 20 years, I told somebody. But they are one of the main symptoms. And it's a very embarrassing side of Bechet, very painful side. But I'm saying it in the hope that this might help somebody else who may equally suffer with the similar symptoms. And if my story helps you understand that it could be Bechet's disease, do go to your GP. Look up Bechet's and print off the paperwork and go on the Bechet's helpline and website, get the relevant paperwork, print it off and take to your GP. You do tend to get sent to the gum clinic first, no matter what your age, and it can happen to 80-year-olds. But they do swab tests and send them off. And when they come back benign, generally you get sent to a neurologist, and then you hopefully get diagnosis of Bechet's disease. But it's a very unpleasant side. And with me, I would have not just one ulcer in my mouth. I would get 20, 30, 40. I mean, we've counted up to 60 ulcers in my mouth at one time. They can become so severe they make your teeth loose. They alter your taste, your sense of smell. You get them up your nostrils. It also, I mean, because it's systemic in your body, it can affect anywhere you can get skin lesions. I had skin lesions where I could be absolutely fine and put my makeup on and go uptown, and suddenly I would have a lesion just appear on my cheek or on my hand, and my skin would split open, and eventually it would ulcer. You'd get uveitis, iritis in your eyes, so you have to be very careful about things like that. It can cause polyarthritis, symptoms similar to Crohn's disease because the ulcers are in your bowels. Stomach ulcers, you get lots of bleeding from your stomach. And it varies. It comes in flares and goes in flares, and it varies in intensity. But it is really important to get a diagnosis.
And in the year that you've been taking LDN, how has your condition been?
Well, I mean, one of the main treatments for Bechet's disease is immunosuppressants. They need to dampen your immune system, because that's always been the belief. If they can lower your immune system, your symptoms will improve. And when I went on immunosuppressants, it did help for a start, but my body just fought back. And after so long, they just didn't work anymore. But once I started taking LDN, it's very difficult to explain, because you're obviously immune system's not being lowered. It's being run like it should do, I suppose. It puts everything back on in sync. And it did help. It has helped my Bechet's disease, but I do still have the odd flare-up, but it's never as bad as it was, and it's nowhere near as frequent. I mean, saying that, I've probably had 2 flare-ups since 2011 of my ulcers, especially down below. The vaginal ulcers have greatly improved. I still get the little mouth ulcers. I still have the polyarthritis, but nowhere near as bad as it was. It's really brought it on an even keel where it's manageable, more contained, so to speak.
Mm-hmm. Well, that's amazing, isn't it? Absolutely amazing.
It is, yeah. I mean, but from being almost, I felt like I was written off, basically, having that Bechet's disease and then MS. I didn't know where to turn. Once we got the diagnosis of MS, well, it was just devastating. I've got 2 children with my husband, and between the 4 of us, I was really dead and buried. There was no future for Mum, and that was silly. It was lack of education, really, on our part. But I mean, life was pretty grim at the time. Once I took the LDN, my life came back, and it sounds so stupid and such an easy thing to say, but it did. It literally did. And I haven't looked back, and I will never stop taking LDN, never. When things change, because they keep talking about licensing and all this hoo-ha with pharmaceutical companies, I will fight tooth and nail and do whatever I have to do to have LDN in my system every night. I haven't missed a dose since I've been on it.
What benefits would you say, Jo, having a small dog is to people who are incapacitated and at home?
Oh my goodness, it's numerous. A little dog will love you for who you are. They will never judge you. They will ask for their walkies and their fun times because they know you're well, but they also know when you're not well and will lay by your side and let you have peace and quiet when you need it. They are inspirational to a human with an illness. The therapeutic properties of a dog, well, my goodness. The stress involved with ill health the emotional side. You can feel so ill, so stressed, everything's really heightened. But once you've got your little dog on your lap and you're stroking it, your body literally calms down, you de-stress, you have this one-to-one bond with your little companion. Most of my, what I call clients, my new pet owners, have all said, even with good health, you know, what benefits these little dogs bring for de-stressing at the end of the day. I mean, they're just amazing. One lick from a dog can, you know, just completely de-stress you and make you feel more comfortable. It's been proven that they reduce your pain, because I think they are a little bit like LDN. They help you release your endorphins. And if you're happy and content, you know, it has great benefits on your health. And these little dogs just give you so much. They give you routine. They give you something that you have to get out of bed for in the morning. You have to get up and feed your dog. They're not going to let you lie in when they're hungry. And they're not going to let you sit in front of the telly all day when you can be out for a short walk. They give you a purpose. And that's really important when you're poorly, because it's so easy, as I did at one point, to just curl up and give in to poor health. And your dogs, they give you some of your life back. They give you, as I said, routine, and that's really important.
Well, I hope that if anybody's interested in rescuing one of your dogs, that they'll contact you, and your phone number is on your website. So
Yes,
thank you very much, Jo. Thank you.
Oh, you're welcome. That's fine. Thank you.